Verizon tells us it's 6 o'clock, so, or maybe it's AT&T, one of them. Yes, thank you. Calling to order the County Standing Committee, August meeting of the County Standing Committee on Finance and Rules. At this time, I'd like to offer privilege of the floor. Seeing no one coming to a microphone, we can move on to the minutes of the last meeting. Any corrections, deletions, additions? If not, they'll stand as presented. And on to the audit report with Luke Malecki of Malecki and Drescher and Malecki.
You can call it Malecki and Drescher, that's fine. Good evening, everyone. I am Luke Malecki from Drescher and Malecki. I was the engagement partner on the county's audit. We recently concluded our audit procedures. This is the last step of the process. I think you're familiar seeing this presentation. We did meet with the audit committee at length in July and kind of had a detailed conversation on the information I'm going to go over today. Certainly, if you'd like a copy of these slides, request them of the treasurers, and she can have the PDF and distribute to you as needed. The actual financial statement packages have been delivered to the county administrator, and upon approval will be distributed, I believe, later this week, possibly as soon as tomorrow. So tonight, the point of the presentation is kind of go over what the point of the audit is, what our role is here, any findings, significant deficiencies, material weaknesses that we noted during the procedures, and then we'll take a real high bird's eye view of the financial statement activity for the year ended December 31st, 2017, which the information has not changed much since April when the AUD was filed. So the conversation may be a little stale and outdated, but that's the way the procedures go with the way counties are audited these days. Foremost, we're hired to perform an audit of the financial statements. And what that means is we perform a series of tests to determine whether or not the numbers that are in that financial statement package can be relied on. The people that are relying on that are your bondholders, state and federal aid agencies, and then, of course, the citizens of the Jefferson County. So we did issue an unmodified opinion. An unmodified opinion is what we would refer to as a clean opinion. In other words, the financials are free from material misstatement. We'll never give an accurate opinion or any of those words won't appear just because we can't test the entire population of the financial statement data. We test samples, and if anything comes to our attention that's out of whack, we'll propose an adjusting journal entry or have the county adjust it. There were no adjusting journal entries. That's a good sign of how things are run in the treasurer's office. We also perform what's called a single audit. A single audit is an audit of the federal awards. It lumps all of your federal award dollars into one big basket, and we put it through a risk assessment program and kind of shake it out and see which programs we'd have to test. Typically, we test about 3 to 5 programs at a county every year. This year, we were lucky enough to get into 7 of your programs based on the way the risk assessment worked out. Some new money coming in, just the rotation of programs, some higher level items here and there. We tested foster care, adoption assistance, Medicaid, social services block grant, the highway planning and construction grant, emergency solutions, and the community development block grant. So all of those programs, from a perspective of the finance and rules and the county legislators' viewpoint, you had exposure to 7 different programs, about 4 or 5 different departments that we went into to test the compliance requirements that are set forth from uniform guidance, and each of those programs indicated that there were no items that represented a federal award finding or a question cost. So both very favorable things. If you did have one of those that came up, you'd be getting a follow-up call from the federal government. They do watch that and they do monitor it. The treasurer submits to the clearinghouse, the federal clearinghouse, what's called the data collection form, and within there it indicates whether there are findings, and then they do require a follow-up on those. So a great highlight showing that there were no findings with a single audit. The next 2 items are 2 letters that we issue. The first is an auditor communications letter. I'm not going to get too in-depth with that because it's kind of a boring issue that goes through my responsibilities and my roles, management's responsibilities, their roles, key estimates, independence, and those sort of things. We are required to communicate that with the audit committee. That was part of our communications back in July. The one item I will bring up that I feel is the most significant part of that letter is the implementation of what we refer to as Government Auditing Standards Board Statement Number 75. That's commonly referred to as GASB, Government Auditing Standards Board. And what it does is it gives the rules that govern what your financial statements contain and how they're presented. GASB 75 took an old GASB, which was called GASB Statement Number 45, and kind of transitioned a little bit. GASB 45 was the one that was required to start reporting the other post-employment benefits liability on the financial statements. It's the one that hit only the government-wide financial statements. The fund financial statements continued to be pay-as-you-go as they were. GASB 45 said that counties and all governments throughout the country could step into that huge liability, which was somewhere, last year it was estimated to be somewhere in like the $350 million range. GASB 45 was allowing you to slowly amortize that cost. It actually got up to about $162 million, so almost halfway to the full amortization. And then GASB 75 was issued, which said, you know what, that was a bad idea. You guys got to book the whole thing now. So what it did is it took that $162 million and almost doubled it, or more than doubled it to about $417 million. It's a big number, but every government's doing it now. It sounds kind of like a peer pressure thing, but we're required to report it, and it's on the government-wide financial statements only. So those first 2 items, that includes your long-term debt, your capital asset items. But it is what we would refer to as a restatement, and it's a significant audit change, so I wanted to bring it to your attention. It spoke about in detail in footnote 2 to the financial statements, as well as I believe in footnote 8 to the financial statements, and then it has a little blurb in it within that auditor communications letter. If you still want further information on that, feel free to reach out to myself. My information will be up there on the last slide, or Nicole, who is the senior manager, couldn't be with us tonight. The next bullet is the management letter. The management letter just details a couple of different observations we had during the audit, nothing significant. We did discuss some other items with the audit committee, with management. We've always been well received with our management letter items and our discussion points. So we don't tend to dwell on them because they are taken seriously and reacted upon. Also within that management letter has a long list of new GASB statements that will be coming along the horizon over the next few years. We'll certainly work closely with the Treasurer's Office and administration to make sure that those GASB statements are implemented as necessary. The last 2 bullets are just 2 minor reports that you're required to file just because you run a CHIPS program and pave New York money, and then as well as the airport's passenger facility charges. Each of those last 2 bullets follow similar lines as a single audit, in which we have to gain an understanding of how the processes work, and as well as have a set of required compliance items that we would have to test to make sure that you're following those compliance areas. Those 2, similar to the single audit, had no findings and no compliance items as well. So within the financial statements, the last area where you could have findings is if an item came to my attention or our auditor's attention that warrants the attention of the legislature, which would be considered a significant deficiency. If those significant deficiencies could cause a material misstatement to our financials, it gets escalated to a material weakness. This year, similar to the years past, there's one significant deficiency that's related to the solid waste fund and the budgeting there. This year, actually, though, we're able to put a positive light to it in that there was progress made in the observation that was in past years. So not only was there about a $300,000 pay down of a current loan between the general fund and the solid waste, but the solid waste was actually able to make that extra $50,000 payment on the long-term liability. So we did go back and forth on our end to see if whether it still was a significant deficiency, and the end of it is that until the trend's been established that that payment's been made on a regular basis, it's the first time in the last 3 years that it has been made. To me, it warrants the attention that the legislature knows of where that status is. So as you progress through the years, if that payment continues to be made, I guess that significant deficiency could be removed. So it's still certainly something to keep our eye on, but a great step in the right direction. Now we're going to go through a few of the financial statement items. These numbers are from the state AUD, so they differ slightly from what the audited financial statements are, but to the tune of a couple $100,000. Just some little items that shook out in between the filing of the AUD and the actual performance of the audit. So the first slide we're looking at here is really just the trends, and I think obviously the trend is pretty level. When you look at your 5-year average for your revenues, it actually is increasing by 0.7%, which doesn't sound like a lot, but when you factor in that your expenditures are actually decreasing by 0.1%, so 0.1%, essentially staying even, that increase in revenue has allowed the county to start to rebuild that fund balance, which was the action of the management and the administration over the past 3 years. When the fund balance level started to fall outside of that policy, the reaction was made, and that's what you're seeing here as the long-term trend. There's a slight kind of hike in 16. That really is the cause of a one-time $1.5 million revenue from the tobacco settlement revenue that happened. It's a clearing fund that we talked about last year that was liquidated. So if you took that out of the equation, it's still a slight increase over the last 5 years, but it's more along the lines of a 0.5%. When you look at the year ended 2017, the estimate and the goal of the budget was to use $7 million of fund balance, down from 10 to 11 back in 13 and 14. Again, part of that reaction to the fund balance decreasing. When we saw the actual activity, revenues fell short a little bit, and that mostly was due to some timing in the state aid. When you look at the state aid on a later chart, you're going to see it's a real rocky road because things get hung up in Albany. Some grants and some departments will come in, and it's really hard to predict state aid. So some years, like last year, you're going to have a positive state aid. I think it came in at about $22 million. This year it was down to about $19 million. Well, we look at the long-term average of how state aid is doing, and it's actually staying pretty level. On the expenditure side of things, there were some significant savings in the health and economic assistance and opportunity areas. That's where all your social service programs are. You're required to provide programs on behalf of the state of New York to the public, and you're acting as an agent, but part of your budget has to include if all these costs came to fruition. So there's always an inherent cushion in that line. So it's expected to see that again. As we saw this year, there's about a $5 million savings in there, which actually pretty much offsets that missed the mark on the state aid due to the timing issue. There's also some savings in general government support and the education, which general government support, some savings within the salaries and overtime areas. And then in the education line, just providing, similar to the public welfare, you're required to budget for providing services to handicapped students. If they don't use those services, then they're not going to be applied. And then there's some budgetary savings within the health insurance. Again, kind of have to budget for the worst case scenario there, and that didn't have to get tapped into. When you compare it from one year to the next, this year's revenues went down a little bit, and a large part of that was that receipt of that tobacco settlement revenue last year, which offset also helped the decrease was that state aid timing issue, offset by an extra $1.5 million in sales tax when you compare 17 to 16. You can see here that the top portion is that sales tax. Clearly from 15 to 16, that's the first year of that extra 0.5% that came into play, and kind of helped to change the trends of the fund balance as well, and allowed the opportunity for the real property tax reduction in 17 of about $400,000 there. The bottom four categories, you can see they stay pretty much consistent and actually decline. Those are the items that you really can't dictate to the extent, other than departmental income a little bit, you can adjust your rates. But your state and federal aid, that's just going to be given to you, whatever the programs in the state and federal aid are going to offer. So the only portion of this graph that we can control in this area is that real property tax. Everything else is kind of, you're at the beck and call of the revenue streams. On the expenditure side of things, you can see the tightening of the belt, so to speak, over the last 5 years. Certainly in the economic assistance and program, a lot of that savings is from the administration of the program. It's coupled by offering or having to use less services in the last year or two, but a large portion of that reduction is actually the administration. General government support, you can see at first glance, it looks like it increased a little bit, and although that does cover all the charges that kind of run the government and don't fall into one of those specific other categories, the big part of the reason of why it's changing over the last 5 years is the distribution of sales taxes within there. As I said, you brought in an extra $1.5 million of sales tax in this past year. You also distributed about $1 million more. So although it looks like your that second item there went up about $1.1 million, the actual true increase on cost of the government is actually closer to about $100,000 there. Public safety increased slightly. That was just the outboarding of inmates caused about a $300,000 uptick, some health benefits, and then just regular salaries and overtime increases in that category. All the other categories, aside from transfers, stay pretty steady from year to year, and transfers is really just funding capital projects in other areas throughout the county. This chart we like to show just because it's kind of, it is the goal of the county to have a ratio of revenues to expenditures to be 1. But when you were in a position where you were in 2014, where the fund balance policy triggered an era to start to build fund balance, 14 was, I think, when we started first talking about that, so that gave 15 budget was already in the works. It gave 16 was the first year that you could actually apply the efforts of the reaction to 2014. That's just the way the budget calendar operates. And you can see over the past 2 years that fund balance has begun to be replenished. And it's actually back into the acceptable range, and I'll show you that in a chart later on, in the acceptable range of the fund balance policy of the county. Your long-term 5-year average is at 0.996, so even with those 2 years of increasing fund balance, you're pretty darn close to having that ratio is equal to 1. As a matter of comparison, a 0.005 is a $1 million increase, so over the past 5 years, there's only been about $1 million added to fund balance. So again, when you're looking at the goal and the achievement of a government to have revenues match expenditures, it's probably about as close as the mark as you could get as a 5-year average of 0.996. As I said, we were going to kind of go over that fund balance policy. The fund balance policy reads that it's the available fund balance. So it's your unassigned fund balance and assigned fund balance that's not dedicated to next year's budget. The policy says that it's taken as a percentage net of the distribution of sales tax, but I like to take the full budget in a whole because it's a more conservative approach. If you take it word for word from your fund balance policy, that 10.2% that you see all the way to the right is actually at 12.8. The fund balance policy says that you want to achieve a fund balance between 6.7% and 26.7%. So you fall within that range. The GFOA, which is the Government Finance Officers Association, and certain publications within New York State recommend to have about 17%, which is 2 months of expenditures, which gets you to the tax flows. That would get a goal of about $32 million of available fund balance. You're at about 19.5. So you're pretty close to what the ideal percentage is, and you're well within your range of between 7 and 27%. And you can see the efforts are shown in 14 to 15. Even though fund balance decreased, there was a less use of fund balance in the 16 budget. So the available fund balance actually increased in 15, and then 16 and 17. That's a byproduct of a stable budget from year to year use of fund balance, as well as the increase in fund balance within the annual operations. Just a couple of Other items, we brought up the solid waste at the foremost slide. I did want to note how the solid waste fund did. The revenues actually increased from charges of services and sale of refuse by about $250,000, so a $250,000 increase, and that was matched by about a $200,000 increase in tipping fees. So you look at your profit margin on those two items, the increase actually in the revenues was supported by less expenses, so you saw a positive shift in the net position by about an extra $50,000. Last year, the solid waste fund brought in an increase in net position of about $20,000. This year's net position increased by about $70,000. Net position is a tough number to look at with the solid waste because it does take into account depreciation and some other long-term benefits. We do look at the cash flows a little bit more closely within that fund. Your cash flows from operations increased by the cash position of the solid waste by $300,000. Most of that was used to pay back those loans, the short-term loans from last year, and then that $50,000 payment. So your financing sources was about $260,000. So the net gain in those two kind of components of cash within the solid waste was about $40,000, a positive item. Also this past year, there were no capital purchases, so there was no shifting of cash out to there, which enabled that fund to make that payment. That's something that you got to keep your eye on in the future because you obviously can't go every year without making purchases in such a capital-intense operation as a solid waste. So as you move forward, it's going to be a little bit tricky to start to build into the budget a capital reserve portion to help offset the cost as you move forward. So you're not taking operations. Instead, you're taking a savings account, a capital reserve, to make those capital purchases. That's the formal presentation I have for you. If you have any questions, I'd be happy to field those now. And as I said, these slides are available. Just reach out to the treasurer. My information's up there. You can kind of see it. If you need it further, I'm sure Karen would be glad to give that to you too. So, any questions?
Play legislator. Just a quick question or observation, if you would make, in terms of the term significant deficiency. You
Correct.
kind of explain that a little bit more because it sounds a little bit more awesome or negative than it really is.
More grandeur than it should be.
Yes, right.
So significant deficiency is anything that comes to the auditor's attention that would warrant the attention of the legislature, of the governing body. In this case, the reason we left it in, as I said, is it's still an item that needs to be focused on as you move forward in the future. In our opinion, although it was a good year in the solid waste fund, it was also a year that no capital asset was purchased. So had there have been a $50,000 purchase of capital asset, would the solid waste fund still be able to make that payment? To me, that's an item that the governing body who's adopting that budget and is ultimately responsible to see the ins and the outs of the budget should know where the status of that fund. And if you look at compare the wording from one year to the next, you'll see this year's wording is a lot kinder, I guess would be the way to put it, is that although no payment was made in 15 and 16, we're pleased to say that 17 was a payment. So it's more of a reporting back as a previous significant deficiency, something that we're going to keep monitoring over the years. I think more importantly than dwelling on the past significant deficiencies, the fact that this year's audit indicated no other significant deficiencies, no material weaknesses, and I kind of listed a long rundown of the single audit, the DOT, and the passenger facility charges. There were no findings in each of those programs.
Are there other questions for Mr. Malecki? I like the part where you said it's a step in the right direction. That's the part I like.
Absolutely.
That makes me feel. I wasn't too wild about the part where you said it's going to be difficult. That had me nervous.
Yeah.
One step at a time.
No one said it's easy.
Thank you very much.
Thank you.
Well presented. Well presented.
Okay.
Thank you. Thank you. At this time, I'd like to introduce Community Service Director Roger Ambrose to provide some information on the local impact of the opioid epidemic.
You want me to close it? I don't need this.
Thank you, Joe.
Okay, so first of all, I've been with the county now for almost 11 years, and I've not attended a Finance and Rules Committee meeting. And as much as I love a good audit report, it's okay if I don't come back to the next one. So we were asked to kind of give a snapshot of the current status, if you will, of opioid use, misuse, and treatment programming in our community. I know it relates to a topic that the legislature is considering in regards to a lawsuit for pharmaceuticals that has kind of been prevalent across the state. This data may or may not help you in making that decision. We will I'll continue to send data to the administration to share with you as we accumulate it. And we are really making an effort in the community to try and get good information and good salient data to use to help us make decisions in terms of treatment and programming in the community. And because we're getting funding from the state in so many different directions, particularly in regards to opioids, we want to make sure that we can show that that money is being used wisely and effectively. So we're going to look at a couple of different areas. First, I'm going to just add some stats that more anecdotal, but some of them have been numerically collected from the jail, and then Ann Smith from the Fort Drum Regional Health Planning Organization, who, as you're all familiar with the FDR-HBO, do a great job in connecting community health issues to providers and monitoring our progress in those areas. They have been very helpful in providing us with data. She's going to talk a little bit about how much of a response we have from our EMS system and our law enforcement in terms of calls that they have to respond to in the community regarding opiate overdoses and Narcan use and so on. And then I've also asked the Credo Community Center, Dr. Paisanelli is going to share some stats in terms of our medication-assisted treatment program and our outpatient programming at Credo that will be able to kind of give you a flavor for how many people are entering treatment and for what purpose. We also want to try and gather, and we're trying to collect data in terms of how many people are being referred out for detox services in our community, and we're kind of in the infancy of collecting that information. But to start with, from the jail, the staff and counselors there were kind of collectively said that about 75% of the inmates in our jail are in some way there because of opiate issues, use, misuse, behaviors associated with their use, illegal behaviors, sales, and so on. They tend to think that there's a higher percentage than that. And again, inmates aren't necessarily going to identify that they're opiate users. Keep in mind, our inmates are going through detox while they're incarcerated. And when we do refer inmates out to services, when they are about to be discharged or when they've been processed through the courts, depending on how long they've been in jail, that may mean that they've already been detoxed. And the other thing I think is important to remember is that health care coverage for treatment does not extend to someone who hasn't been using for, say, 30 to 60 days. So it's not a medical necessity. So if someone goes through detox while they're incarcerated and then we try to get them into a treatment program, they may not be accepted. The insurance companies may not pay for them because they've been they haven't been using for a long enough period of time that they're no longer eligible or considered to be actively addicted. So, some of the stats I have: the 185 current inmates. Our mental health counselors worked with 47 of them who were opiate users. Now that's our mental health worker, and our chemical dependency workers we have stationed down at the jail are seeing similar numbers. They're not seeing the same patients. And again, those are only patients that surface. Not all of the inmates go to the mental health counselor. Not all of them go to the chemical dependency counselors. Some of them refuse that kind of treatment programming. So, in August, 9 people received bed dates. 3 are awaiting beds. 11 are waiting to hear if they have been approved for treatment facilities. And again, that can depend on whether they have exceeded the number of days without using that makes them no longer eligible for insurance coverage. And it doesn't include those who refuse to see either a mental health counselor or a chemical dependency counselor. So we're looking at very high numbers inmates. We would expect to see higher numbers, but to me, 75% actively or engaged in opiate use, that's a substantial number. And it's probably, I'd be taking a shot in the dark, but I would say it's at least 60% higher than it would have been 5 years ago. So we've seen a real rise in the number of inmates that are being treated for opiate use, or not being treated, who are showing up in our jail having opiate issues. So I'm going to introduce John Wilson right now. John's and I'm not sure what your title is, John, so help me out, but John was the residential coordinator for Credo. I think he's program director now for the Credo Community Center. And he's going to introduce Dr. Pisanelli to give us some stats on their treatment programming. So, yeah.
No, Director of Operations. Good evening, everybody. I just wanted to take a quick minute and introduce Dr. Pisanello to everybody. Dr. Pisanello is a graduate of Cornell University and Albany Medical School. He's certified in both family and addiction medicine. Dr. Pisanello worked as a primary care physician in Lewis County for 26 years, and during that time he also started working part-time for what was then called the Lewis County Alcohol and Substance Abuse Treatment Center, prescribing Suboxone for about 10 years. Since leaving his primary care practice, Dr. Pisanello has been working full-time in addiction medicine with Credo since July of 2016. I personally consider him one of the local experts in addiction medicine, so and with that being said, I'd like to turn over. He's going to share some stats with you and some statistics that we are seeing and we're seeing in our clinic. So thank you.
I think I'll start by just a word about how we're organized at Credo, because I think the statistics will make a little more sense if I do. Originally, there was just the substance abuse clinic. That is now called the IOS, Integrated Outpatient Services, because we offer both mental health services and substance abuse services. So we have the IOS clinic. Then, in September of 2016, we opened up our opioid treatment program, the OTP. And in the OTP is where we see people who have opioid use disorder and can come in daily for dosing. In other words, they don't keep their medicine at home. Generally, they come in, get their dose of methadone or Suboxone under supervision, make sure it's consumed right there, and then they go home and they come back the next day for their next dose. That's the only way you're allowed to prescribe methadone for addiction in this country. You're not allowed to send it to a pharmacy like you would Suboxone or Vicodin or penicillin or any other medicine. You have to get it through an OTP. So having the OTP enabled us to do daily dosing of methadone. It also allowed us the option of doing Suboxone through our OTP for people that have opioid use disorder. It doesn't have to be given in an OTP, but if we have somebody who we think maybe has been untrustworthy with their Suboxone, maybe selling it, or maybe they didn't keep it secure and it was stolen, or we just are worried about how they're doing, we can insist that they get their Suboxone through our OTP. So we can see them, and actually 2/3 of the people that we are treating with Suboxone at Credo now get it through the OTP, not through just going to the pharmacy and picking it up. In the OTP, when a person first starts there, they come in and get dosed 6 days a week. We are closed Sunday. They get a take-home dose for Sunday and also a few major holidays. If they're doing well, after a certain period of time, 90 days, 180 days, 360 days, they can get more take-home. So some people that we have are doing well enough that they only come in for their dose 3 or 4 times a week, and the rest of the week they get take-home doses. So right now our census in the OTP is 115 people. Of those, 90 are on methadone and the other 25 are on Suboxone. And so 22 people are receiving Suboxone in the OTP, 13 receiving Suboxone through our IOS, through the inpatient integrated outpatient services. In addition, since we started the OTP, we've had 8 pregnant women getting medication, usually methadone or Subutex, which is like Suboxone, through our OTP. And pregnant women are especially important because if a person is using opioids, you don't want them to go through withdrawal during the pregnancy because that poses risks to the pregnancy. And you certainly don't want them out there just using opioids on the street. It's better if they're using opioids to just keep them on opioids in the OTP through the remainder of their pregnancy and let them deliver, have a healthy baby, and then you work on what you want to do from there. Right now, we have about 19 people that are, I don't want to use the term waiting list because we don't really have a waiting list in the sense that we have to wait for someone to leave before we can admit another person. But we have about 19 people in the pipeline. And those people, I think 7 are scheduled to be admitted in the next week, or this week or next week. The rest are either waiting because of maybe they missed an appointment with their counselor that needs to be done before they can be admitted. Transportation is sometimes an issue for these people. They could be in the waiting list because they're using a benzodiazepine medication, which is dangerous to use with methadone. Or it may be just because we're a little short on staff. Experienced counselors can see more people in a day than inexperienced counselors. Unfortunately, we just lost one of our experienced counselors and replaced her with an inexperienced counselor, so our volume goes down for that reason. But I think 150 now is the most we've ever had in the program. Since January of this year, the average new people coming in for looking for services with opioid use disorder is 11 a week, and that really hasn't decreased yet. So we don't know where the wave is going to crest, so to speak. And out of everybody in CRADO, both all the OTP plus the iOS, we have a total of 521 people. Of those, about 50% have opioid use disorder as their primary diagnosis, 26% with alcohol. So almost 2 to 1 opioids more than alcohol, which I've been in the field for a long time, and it used to be everybody you saw pretty much was an alcoholic. Now alcoholics are the minority, and everything you're seeing is opioids. So that's really changed over the years. We also have issues with space where we are now. We've been working with the OASAS to acquire more space. The building next to us, what used to be the JRC, is hopefully going to be more space for us in future years, but that's still in the works. And then I think some of you got a handout, but Jefferson County statistics, what we have. And one thing I would point out on that table is that there were 18 opioid overdoses in Jefferson County through the entire year of 2016, and that's really most of which we weren't open. And when we were open, I think by the end of the year we still only had like 20 or 30 people in the program. So we were just getting started, and the overdose rate was 18, or the number was 18. And then the first 6 months of 2017, there were 2. So hopefully we're preventing overdoses. I mean, it's not because the amount of opioid use has decreased in that time. We're seeing more people than coming in. We're seeing a steady amount of people coming in every week. But even though we're still seeing a lot of people, hopefully they're not overdosing as much, they're not dying as much. That's what we're after. So, does anyone have any questions? Do you know, John?
Would you mind coming to? Thank you.
The people that are still going to Syracuse are people that had established with the programs in Syracuse and didn't really want to switch physicians and prescribers and their clinicians. So we're working, to try to keep those people in county, but there's still some that are established in Syracuse.
There are some people that we see that they switch to us from Syracuse because transportation won't take them to Syracuse anymore, but there's others that don't seem to have a problem with that. I don't know why, other than maybe they have their own transportation.
Assuming a level of success, obviously, which kind of sounds like you're moving in the right direction. With 115 people now, or maybe 150, how long, maybe on average, is somebody a part of the program?
Ideally, lifelong, because we know if you have a large group of people that are on either Suboxone or methadone, and let's say half of them decide to taper off, the other half just stay on it because they're doing well and they just stay on the same dose. And you look at those two groups 3, 4, 5 years later, how many relapsed in this group versus how many relapsed in that group. The relapse rate, several studies have shown this, the relapse rate is much higher in the people that have gone off. So if people are doing well, I'm fine with them not rocking the boat. Stay on. We think of it as a chronic disease, like a person with thyroid condition who has to take thyroid medication every day. This person has to take their Suboxone every day and hopefully go about and be productive citizens. Right. But people that are using big dose heroin, they use Suboxone to help them detox. Yeah. It depends. There's some, I mean, if we can, it's really rapid. Like if someone's coming from inpatient and they're on medication already, we just try to make that a smooth transition. Obviously, if they're transferring from another program, we will guest dose them at our place until we get them in. They won't be without medication. For people that, like I said, some of it's complicated by, I don't really have the exact figure, but sometimes people don't show up for one reason or another, whether it's their own fault or not, and that slows down the process, and it's hard to get all the information we need to even assess if they're appropriate for the program. But, I mean, our goal is to get everybody in as quickly as possible. When we started, we were insisting that people get lab work done and an EKG done before we started them on methadone, because that really is better. But now our thinking has changed, and I think if we get them in the program and they start to feel better, they're more likely to stay with us and get their lab work done later. So we're a little more tolerant with that than we used to be.
Attorney Paulson, you had a question?
Yes. I would say probably more heroin now than prescription. Some people use only prescription drugs, but they're minority. A lot of people started off, most people I think, started off using prescription drugs. But then as the screws tightened on doctors prescribing and prescription opioids became more scarce on the street, they became more expensive, and so that forced some people to, or didn't force, but encouraged some people to switch to heroin because it was cheaper.
Nothing further? Thank you, Doctor. Thank you, Roger.
So if you have any questions along the way, by all means, stop us and we'll try and answer them as best we can. Or if something comes up afterwards and you think of, something that you wondered about or now are wondering about, by all means, send me an email and I'll be glad to get that information if I don't have it myself. So Ann Smith is with the Fort Drum Regional Health Planning Organization. She is one of the coordinators with the EMS program with the HPO, so she's going to share some of our local stats. Thanks.
Thank you. I did pass around a handout, and as he stated, that I work with Fort Drum Regional Planning Organization for the North Country EMS Program Agency. And at the end of 2015, we established an opioid overdose program. Our program, unlike many others within communities, has a focus on ensuring the availability of Narcan to our first responders. And when I say first responders, I mean law enforcement, EMS agencies, fire departments, so those folks that are most likely to be first on the scene. I did put some data in there. We do cover the Tri-County area of Jefferson, Lewis, and St. Lawrence, so it gives you an idea of how many agencies that we have within our program. So we have 10 different agencies within Jefferson County, and they're listed there. 4 of them are police departments, 5 EMS, and 1 BLSFR, which is a basic life support first responder, so it's just the level of care that they offer. When we look back at our administrations for 2016, it shows overall, and again, this is just, it's fragmented data that we receive through Narcan use reports that they must provide back to us to resupply their stock or an expired kit. So in Jefferson County in 2016, there was 186 administrations. In 2017, we only recorded 128 administrations. And then so far year to date, we've only seen 60 administrations. But again, we have to continuously try to get those reports, right? They'll receive a couple Narcan kits, so they may not bring us their report until they're ready to replace their kits. I did also list out on the back side of this some of the weaknesses and the fragmentation that we see, as well as some other explanations. But so our transport agencies is a total of all agencies. in our region that have administered naloxone irregardless of whether we supply that naloxone or not. So that is for all 80 EMS agencies that I oversee, whether they be a first responder or a transport agency. The report does not include any law enforcement outside of the ones noted in the program. So, for example, the state police and some of the other local village and town PDs are not included in that. And just as a note to reference that all of our advanced life support agencies, they do carry Narcan, and many of our BLS agencies carry Narcan even if they're not part of the program. They buy their own supplies. So that's just to give you an overview. We've distributed 367 kits. Of that, 78 have been exchanges because the kits have been expired. And working with our partners, we've also trained over 300 first responders in the Tri-County region in the administration of naloxone. So, any questions?
Yes, Legislator Cantwell.
Why would a BLS or an ALS agency not want to be part of your program, or what's the advantage or disadvantage?
So the ALS providers will give a different formulation of the medication. So they will give it via IV instead of, or intermuscular, so intravenous or intermuscular, versus having the intranasal.
Has a few EMTs which are fairly smallish women, and when you use Narcan on somebody, even though you may have just saved their life, they're not very happy about it because all of a sudden you put them into intense withdrawal, and sometimes they come up swinging. So they were feared for their life. And you can keep a person alive just by breathing for them until they get to the emergency room and then give them Narcan there.
So again, and some agencies have chosen not to do it for those reasons as he has stated. So, but for the most part, some of the other law enforcement entities are receiving their Narcan from other programs. So, for example, the state police all do carry Narcan, and that data is reported through, their databases. So, it's very, very, very difficult to give a full overview because data is coming from so many areas. We report to the state quarterly, and they do try to compile that data. So,
thank you.
Yep. Any other questions?
Anything further? Director Ambrose?
So just to kind of sum up, and I think one of the things Ann talked about was pretty important, and that is just how fragmented the entire opiate system and response is. Tom Carmen referred to it as a scattergun approach, and it's both ways. I mean, the funding that comes in all over the board. We don't always have discretion about how those funds are going to be used. The state makes those determinations, and a lot of times it's made based on more urban areas rather than the kinds of needs that maybe rurally we have, and it's all in different pockets. I mean, like I mentioned before, some of it has been directed at jails now. We've also got funding that we can use to try and work on prevention issues and so on. So it's really all across the board. It's been very difficult to kind of pin down exactly where we're heading and how are we doing. And emergency rooms are having the same difficulties collecting stats and as the treatment providers are, and so on. So the statistics that we have statewide indicate that Jefferson County is kind of in the middle of the pack in terms of lethality, in terms of treatment programming and availability, and response. So, we're not on the behind the eight ball. Actually, we're in good shape in a lot of ways compared to some of the counties in our area. We have more enriched programming, more availability, more access. But again, is it making a difference? And I think that's the key is, for us, is to try and determine, is our response making a difference? Or are we just kind of spinning our wheels here? So if you have any further questions, like I mentioned, by all means, just drop me an email, and I'll, if I don't have the answer, I'll talk to one of those people that were here that do.
Let me just advise that Roger gave me some written materials this evening that I'll distribute to you electronically tomorrow, so you get a chance to look a little bit more on some of what is taking place.
Yeah, that was a little more like an audit report, so you may want to take some time to read that one. Thanks.
Thank you, Director Ambrose. Okay, on to the regular business of the committee, the Finance and Rules sponsored resolutions.
The first resolution this evening is payment of legislator expenses.
Have a motion, please. Legislator Nabawanek, Legislator Drake. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Next resolution is amending the 2018 county budget relative to the Community Services Department.
Motion, please. Legislator Johnson, Legislator McBride. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Third resolution is selecting an airport consultant and authorizing an agreement for airport consultant services at the Watertown International Airport.
Motion, please. Legislator Nabawanek, Legislator McBride. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Amending the 2018 county budget in relation to the probation department and creating a probation officer position.
Motion, please. Legislator Cantwell, Legislator Drake. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Authorizing extension of lease agreement for parking rights at the Lower Department of Social Services lot.
Motion, please. Legislator Drake, Legislator Johnson. Discussion. Hearing none, all in favor? Opposed? Carried.
Appointing Director of Code Enforcement.
Motion, please. Legislator Nabawanek, Legislator Cantwell. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Amending an agreement with the Thousand Islands Regional Tourism Development Corporation for the provision of public benefit services for promotion and publicity.
Motion, please. Legislator Drake. Legislator Nabawanek. Discussion. Hearing none, all in favor? Aye. Opposed? Did I say that already? I lost my train of thought. Nobody's opposed, so we're moving on. I was just excited about that resolution. It took a long time. The resolution sponsored by the General Services Committee.
Amending the 2018 county budget to recognize insurance recovery and allocating same in the dog control department budget.
Motion, please. Legislator McBride, Legislator Cantwell. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Authorizing agreement and amending the 2018 county budget in relation to the New York State Empire State Development Grant.
Motion, please. Legislator Nabawanek, Legislator Johnson. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Amending the 2018 county budget in relation to the county road machinery fund.
Motion, please. Legislator Drake, Legislator Cantwell. Discussion. Hearing none, all in favor? Aye. Opposed? Carried. There are some informational items for your review. At this time, I would ask that we have a motion to go into an executive session for the express purpose of appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person. Legislator Nabawanek, Legislator Johnson. I guess we have to ask folks to leave. So, yes, with the exception of the DA, the Director of Public Health. Yeah, that's what you got.